Hello and welcome back to Visions for Health. Today we're going to talk about functional medicine with a focus on psychiatry. My guest today is Achina Stein. She's a doctor of osteopathy, and I'm delighted to have her here on the show. Achina, welcome. Thank you for coming.
Oh, thank you for having me.
So talk to me. Did you become a psychiatrist? Did you always know you wanted to be a psychiatrist, or was this something that you discovered in medical school?
Well, I did not know that I wanted to be a psychiatrist, although in college I majored in biology with a emphasis in neuroscience and behavior. But then instead of going into graduate school, I decided to go into medical school because I just didn't like working with rats anymore.
I got bitten by a rat actually in the pre-med program. I can relate.
So when I was in medical school, I was fascinated by everything that I did. And it took me a while to figure out what I really wanted to do. And I started to focus on endocrinology. And that was the path that I was going to take until I did my psych rotation in the last part of fourth year of medical school. And that's when it all came together for me.
Got it.
Yeah.
I think endocrinology is probably very well related to psychiatry when you sort of delve into it. Okay, so you did a psychiatry residency, and then...
Well, actually, if you don't mind me saying,
go right ahead.
I did a full year internship in medicine.
Okay.
And DOs generally do a rotating internship through medicine. So I did surgery and peds and OB-GYN, delivered babies, and cardiology. So I did a full year of medicine and surgery before I started my psychiatric residency. Yeah.
Talk to me about the DO portion of it. The doctor of osteopathy is also medical specialty. Well, just like allopathic, it's a similar track. What kind of training did you have from an osteopathic standpoint that you bring into your treatments?
Well, osteopathic physicians are trained with an emphasis in the musculoskeletal and neural system. So we have the same training as all of the allopathic physicians or MDs, and but a little bit more emphasis in the musculoskeletal system. We have a more holistic approach, and most of the DOs, 60% I would say, go into primary care. And from a psychiatric perspective, we are trained to look at the whole person, the whole body. And when I see a patient, I watch how they walk into my office to see if they have any problems with with their gait. And I look at their hands, I look at the way their posture, see if there are any sign of them being in pain. And there has been rare occasions that I treat patients. I've once treated costochondritis, another time I treated migraines, but only if the patient is willing to go down that path. Yeah.
So it sounds like osteopathy from a philosophical approach gels beautifully with functional medicine and psychiatry.
Yes,
It just seems like it's sort of a very natural evolution. So in your approach with patients, how do you use functional medicine, or how are you evaluating patients who come to you for a consult?
Well, I think psychiatrists are actually in a very unique position to be able to do a complete functional medicine evaluation, because we're very, very good at getting a full history and a detailed history. And a lot of functional medicine doctors who come from other specialties have to learn that piece, whereas we're actually trained to get a really good history, and we're trained to do it in such a way that you're motivating the patient to approach wellness and want to get well and to help themselves. So
this is motivational interviewing, is that what it's called? Okay.
Yes. So, so when I see a patient, I do a complete psychiatric evaluation, and what that entails is getting a history of what's going on right now, and to find out when that person last felt well. And that could be when they were 5 years old, or that could be in the last 10 years. So that's kind of a good starting point to figure out the history of how things transpired over time. Okay. And so generally, psychiatrists will focus more on their past psychiatric history, and we also get a medical history, surgical, full social history, legal history, trauma history.
You got a great story.
Yeah. So, and then we do a mental status exam, come up with a diagnosis, and come up with a pretty well-rounded treatment plan using the biopsychosocial approach. Okay. So, functional medicine is more on a biochemical approach, in that we're looking at the cellular function. We're looking to see if a person has been exposed to toxins, whether or not they've been, how their immune system has responded to different stressors in their life, what kinds of stressors that they've had in their life. So I get a different kind of history to get that kind of information. And that might include getting a history of antibiotic use, whether or not they've been on birth control pills for a long time, whether they've had treatment for prednisone, whether they've had gut problems and numerous rounds of antibiotics, early history of ear infections, colic. These are starting from a very young age, and you can pretty much see how things transpire and where different things in their life came together, sort of like a perfect storm, and when things really started to fall apart for them.
Okay, so I have a million questions based on what you just said. First, you said about, so you've done your history, and you're layering on top of it now a very detailed biochemical evaluation. And you mentioned something about toxins. Have you found that when people have a very high toxic burden, this also shows up in their psychiatric profile? That someone who had say they're a shipbuilder, are these people who have struggled possibly with also anxiety or opposition or depression, or is there some relationship there?
There is. It's difficult to know which toxins. It seems in general that it is toxin burden. It could be a number of toxins, not just mercury or lead. It could be a number of things, exposure to BPA, it's pesticides. So, sometimes it's a matter of digging a little further for that kind of history. And I don't necessarily do that in the very first evaluation. I mean, if you can imagine, I spent an hour and a half with a patient.
That's a long time.
There's been times when I've spent 2 hours getting a history, because I like to be able to get a picture. I always explain to people that when I get their history, it's sort of like finding the puzzle pieces of their life, and for me, it's putting those pieces together like a jigsaw puzzle. And you don't necessarily see the picture of the jigsaw puzzle when the pieces aren't together, but when you start putting them together, you start seeing the picture, and that's what's really important for me to do, to be able to get the whole picture of that person. So it takes some time.
Yeah. So this is a progress over time. This is not one visit and then see you in 6 months.
Right.
This is a much more detailed evaluation. Okay.
Yes.
What are the typical things that you would do that you're perhaps before you started functional medicine you might not have done in terms of a biochemical evaluation on a patient? Like, what are you looking for? If you've done your whole history, what are the tests
that I do now?
Yeah.
Well, I basically treat the gut first, because most people who have psychiatric problems tend to have problems with their gut, believe it or not.
Can you say more about that?
Well, a lot of people don't realize that their gut is where 85% of their serotonin is made, and 85% of their immune system is made in their gut. So if a person is having inflammation in their gut for a variety of reasons, which we need to try to uncover, but generally people have symptoms of irritable bowel, or have bloating and, you know, problems moving their bowels in one way or another, if they have those kinds of symptoms, they'll usually, that will usually be uncovered during the interview. So,
And why is serotonin important?
well, serotonin is one of the neurotransmitters that's really important for the brain in order to have a sense of well-being, essentially.
Okay.
So when people have problems with their gut, they usually are unable to make serotonin. And that's usually the beginning of having symptoms of depression and anxiety.
So I think we need to pause because this is revolutionary for most people to hear, because you think your brain produces all the things you need, and if you're depressed, it must be a problem in your brain. And you're saying if you're depressed, look here in your gut as opposed to in your brain.
Right.
This is amazing.
Yes, it is.
And when you say this to patients, do they say, "Doc, you got to be wrong," or do they say, "Oh my God, I've never thought about that," or what do patients feel?
Well, people are kind of surprised, but then it's interesting. I think people are well read enough that it kind of like, wow, that makes complete sense, you know. So it doesn't take much to convince them of that, and when we go through the different biochemical processes of how serotonin is made and how dopamine is made, and then it comes together for them too. And then they're actually much more motivated to actually make changes in their diet if necessary, or in taking supplements to help, you know, decrease the inflammation in their gut. You know.
So you can test people's serotonin and dopamine and norepinephrine. You can test all these neurotransmitters for people?
We can. That's not necessarily something I do right away, because there's so many other things that might take place first. But in the last year that I've been with Visions, I haven't really prescribed many psychotropic medications. I would say maybe 3 antidepressants.
Wow.
In
a year?
In the year.
Wow.
Yeah, and I've actually taken many people off of psychotropics because they have made so many changes in the way they do things that they don't need to be on those medications anymore. Their gut is making all of the neurotransmitters that their brain needs.
So what's a typical way that you're going to evaluate somebody's gut function? When they walk in and they give you their story, and you say to yourself, oh, this is a gut issue. Mm-hmm. What do you do next? Is it a hard thing to figure out? Is it easy to figure out? What happens?
Well, at first it takes quite a bit of time educating the person, you know, explaining to them why it's important to look at the gut. What a number of people don't realize is that, you know, when we come up with diagnoses, it's a name for a cluster of symptoms that come together. It doesn't say anything about why this person is experiencing these symptoms. It doesn't talk about underlying cause or root cause.
You're naming it.
You're naming it. And so, you know, sometimes people will say, well, I had psychological testing that says I have ADD. Well, yeah, you have the symptoms of ADD. It doesn't say anything about why you have those symptoms. Okay. So I explain a lot. It's a lot of education up front about why someone has attention problems or memory problems or depression or anxiety, and how that transpired using the history that they gave me. Mm-hmm. And it's using their own words and using the history that they gave me, and then the light bulb kind of goes on for them. So, you know, basically I talk about how we treat the gut and some of the testing that we do. We do food allergy testing.
How do you do that?
There is a test called an ALA test, which is it's IgG food allergy testing for delayed reactions in food sensitivity. And
so this is a blood test?
Correct.
Okay.
Yes. And we might look for deficiencies in minerals and vitamins. Many people are very deficient in the B vitamins, and it's well known that B12 deficiency, folate deficiency can lead to depression and anxiety. and memory problems as well, thiamine deficiency. So we look at all the B vitamins, and we look at magnesium, zinc, selenium, copper.
It's pretty straightforward, though. I mean, theoretically,
It is.
I mean, it's just a revolutionary approach to a very straightforward data collection, except for the IgG, I think, which you mentioned.
Right.
What happens after patients get their IgG blood test for food allergies? They come back, they see you, and you talk about it, or then what happens?
Well, those are some of the tests. There's a whole bunch of tests that we do, which I won't go into now. But basically, we have a session just going over all the blood work that was completed, and I explain it to them in the context of their symptoms, and then we come up with a treatment plan about how we're going to replace what's missing in their body. But ultimately, what I explain to them is what we really want to do is have them change their diet so that they can include all of these things that they're, missing in their food, so they don't have to take supplements for the rest of their lives,
Although that's pretty hard, I think, given, especially where we live in the Northeast, that it's hard to get food out of season necessarily, or it's been bred and the genetic components aren't as healthy necessarily.
Right.
So,
yeah.
So you mentioned something to me before we started filming about someone who, this is just a patient example, who you were seeing a young woman who, can you say a little more about that example? Because it sounds like your goal is to have people be in balance.
Mm-hmm.
So can you give that example that you gave me about that young girl whose parents brought her in?
Yeah, she was about 14, 15 years old, and her parents sought me out because they wanted an integrative approach to treating her symptoms. She had mood lability, she would get into arguments with her sister, was oppositional with her parents, would have difficulty completing her homework, just wasn't really an easy kid to get along with.
Yeah.
And her parents really did not want to use any psychotropics at all. So I get a full history, and we did the testing, and we found that she had some deficiencies. It seems like most people are deficient in some B vitamins, magnesium, and zinc. Those are the biggies right there. So, but we also did the food allergy testing, and we found that she had numerous sensitivities. But it seemed more than anything that she had sensitivities to carbohydrates. And so I had her see one of our nutritionists, and she basically created a diet for her that was very, very limited in carbs. And as long as she stuck to 20 grams of carbs every 6 hours, she has figured out that she can have herself how much she can have. And it took a while to convince her that this was directly related to what she ate, because she did not want to give up some things. But then she found that with working with her parents, that if she really cut back on certain foods, that she would feel better. And then as the time went on and on, where there was longer and longer gaps between using these foods, then when she would eat something that had carbs in it, or some of the foods that she was sensitive, foods that she was sensitive to, then she would react and notice it more and more every time. So, and there were times when she would accidentally eat it, like being at a friend's house or going out to a restaurant, and it was pretty clear, it was so black and white for her, that she started following a very strict diet, and all of her symptoms went away.
Seems hard to do it. I mean, it seems hard to do at any age, but particularly as a teenager, when there's so many outside forces and the desire to fit in. But it sounds like this transformed her life.
Absolutely.
That's pretty amazing.
It is, yeah. Yeah.
Do you work closely with the nutritionist for patients who have sensitivities?
Absolutely, yeah.
So you really do an integrative approach.
Oh, absolutely, yes. Practically all of my patients need to see a nutritionist if that's, if it looks like that there's food sensitivities. There are some things that I find outside of my evaluation that's beyond my expertise, that I would then have them see a functional medicine primary care physician, unless they wanted to go to their own physician to address these issues. But sometimes it's helpful to at least have a consultation with one of our primary care physicians because of the whole functional medicine piece.
Now, just to ask you a few very basic questions.
Sure.
You take insurance?
Yes.
Okay. And do you see, what's the youngest age that you will see someone to typically?
Well, I would say probably the youngest would be 13, 14 years old. I think if there was a situation that a parent had great difficulty finding a psychiatrist that practiced with the integrative or functional medicine approach and had tried to find someone several times and had not succeeded, I might agree, depending on the situation, depending on the symptoms that their child, might experience. But I think that would be like on a case-by-case basis.
Okay.
Yeah.
And do you do couples therapy?
I have, yeah. I do all types of therapy. I do cognitive behavioral therapy, psychodynamic, psychoanalytic psychotherapy. I'm trained in both areas.
Okay.
Mindfulness-based stress reduction. So.
And you work in the Dedham facility at Visions Healthcare?
Correct.
Okay. If you had to pick sort of your favorite illness to treat, what would that be? Do you have a favorite where you say, oh, I love when people can fix X, whatever that is?
Well, I like some of the endocrine problems, all the autoimmune illnesses, and from a therapy standpoint, I like to treat patients that have trauma issues.
So is that all comers for trauma? So physical, emotional, sexual, anything else I've missed?
Yes,
Okay.
yes. And it's interesting that people who have autoimmune illnesses or immune deficiencies, where their immune system is not really regulating appropriately, they tend to have trauma. So trauma issues. So there seems to be a trend there.
That's really interesting.
Yeah.
Now, I had one other basic question I forgot to ask you. If someone needs medicine, you give it to them?
Yes.
Absolutely. Okay.
Yes, certainly. I mean, that's the standard of care. I mean, just because I have an integrative approach doesn't mean I don't treat in a conventional sense. I mean, that would be, I would have to offer that, and especially if they're in dire straits.
So you would medicate if necessary?
Oh, absolutely.
Okay. And then,
yes.
Do people generally come to you because they want to get off of their meds and they want this type of approach? Is that how?
Yes, they tend to find me. Most people tend to find me because they want that approach, but there have been some patients that have been surprised to learn about the Visions practice and what kind of practice it is. So I do inform them up front about what's available to them. And some people are not interested, and some people are very happy that they serendipitously came to this practice. So it depends on the person, but I'll give them all their options, and it's really up to them to choose. I go over the benefits and the risks of all the treatments that are, available to them.
And you mentioned that you use an integrative approach. Are there other providers or modalities to whom you refer patients where you say, oh, I think this would be a good adjunct to your care?
Yes, well, there's times when I have referred to Susan Corso for spiritual navigation, to Rachel French for acupuncture.
These are all guests on the show.
Yes, and there's definitely a place for all of those other modalities. Energy medicine. I do also some energy medicine. I teach my patients on how to do emotional freedom technique, EFT.
I've not heard of that.
It's tapping. You might know it as tapping, but it's a type of energy medicine that people can learn on their own, and well, not on their own, but they can do on their own, and I can teach them how to do that. So it is something that they can do anywhere. So
very cool. So it sounds, I mean, this is just, to me, extremely different from what I think of when I think of psychiatry. This is just such a lovely way to layer the approach to care, because there's great history and then you're taking their bodies into account, and then you're getting great data. And then you mentioned something about the immune system and people's psychiatric balance. How does this, because you said something about people who have autoimmune deficiency often have a history of trauma, and then that shows up as an autoimmune disorder, or what's the do we have any idea how that happens?
Well, stress is a big piece of it, and stress creates an imbalance in the hypothalamic pituitary adrenal axis, the HPA axis, which is the hormonal axes of our bodies. Whenever we have stress, they come into play. And so sometimes that can kind of go haywire on people and create an imbalance in the way their immune response is. So it's related to stress, and especially chronic stress. So,
which all of us have, it seems.
Right.
So.
Right. So it depends on a number of factors. You know, some people have genes that are predisposed to certain kinds of stress more than others. They have a family upbringing that can be particularly chaotic or traumatic. So it's a combination of things, and it's as they live their lives, these stressors build up over time, and eventually, like the rain barrel, the rain barrel gets full and it starts overflowing. So it's not just stress and emotional stress, but all the biological stressors and social stressors. If you have financial problems, job problems, marital problems. So all of that comes together for some people and can really take a big toll on them.
This is really awesome that you're even approaching this. It's wonderful.
Thanks.
We have very little time left. Is there anything that I have not asked you that you really would want to share with our audience?
Well, I think it would be really important for us to change the medical system at some point. As you know, this country is feeling, there's a huge problem with our medical system, and I think by looking at root causes of the problem rather than just treating symptoms with medications just to make them, you know, in remission as opposed to actually treating the underlying cause, I think would be a better approach. We would most likely not be taking as many medications, not requiring as many visits, and really approaching life in a healthier way. Yeah.
Beautifully put. Thank you.
Thank you.
Thanks for joining us for another episode of Visions for Health. My guest today was Achina Stein. She's a doctor of osteopathy and practices psychiatry at Visions Healthcare in Dedham.